Heart failure is often thought as a condition that affects older adults, but the reality is different. Across the world, and even in Nigeria, younger people are increasingly being diagnosed with heart failure. This isn't just a global trend, it's happening in our communities, your neighbors, your friends. Everyone is being affected by this phenomenon because a recent study conducted in southwest Nigeria revealed that heart failure and hypertension occurred for 35% and 32% of cardiovascular diseases over a 5-year period. Additionally, heart failure was identified as a third most common non communicable cause of hospital admissions from 1999 to 2004, following diabetes and cerebrovascular diseases. The average age of every patient in this study was 54.4 years old, with most patients in the seventh decade of their life. It is worthy of note to note that 21%, that is about 89 patients with chronic congestive heart failure, were under 40 years old, while the majority, that's 79%, 334 patients, were over 40. Why is this happening and what can we do to stop it? So today, we're going to dive into the causes, the risk, and the solutions for heart failure in younger Nigerians. Now, first of all, what is heart failure? Heart failure doesn't mean that the heart has stopped working. That is a myth. It just means that the heart is weak and can't pump blood effectively as it should. In younger people, the weakness can result from specific conditions or lifestyle factors that can strain the heart. What are these causes of heart failure in young people? Now, several factors can contribute to heart failure among young Nigerians. Number one, untreated high blood pressure or hypertension. High blood pressure is no longer just a problem for older adults. Many young people, especially in urban areas, develop hypertension due to stress, poor diet, and lack of exercise. Over time, uncontrolled high blood pressure forces the heart to work harder, leading to failure. Secondly, we have what is called heart infections. Infections like rheumatic fever, which can result from untreated streptococcal throat, are still prevalent in Nigeria. This condition can damage the heart valves, leading to heart failure. Thirdly, complications during pregnancy. For young women, certain complications during pregnancy, like preeclampsia or postpartum cardiomyopathy, can weaken the heart. These conditions are especially dangerous when not detected or managed early. Number four, congenital heart defects. Some young people are born with heart conditions that can lead to heart failure if not treated. Unfortunately, limited access to pediatric cardiology services in parts of Nigeria means these conditions can often go unnoticed. Number five, lifestyle choices. Smoking, excessive alcohol consumption, and substance abuse. These behaviors are some that young people often adopt and can lead to damage of the heart over time. Obesity and diabetes is another factor. Rising rates of obesity and type 2 diabetes among young Nigerians are putting more people at risk of heart failure. Both conditions strain the heart and increase the likelihood of cardiovascular problems. Now, how common is heart failure in the young in Nigeria? While exact data on heart failure in young Nigerians is limited, studies have shown that cardiovascular diseases are increasingly being diagnosed in people under 40. In hospitals across the country, a significant number of heart failure cases involves younger patients, many of whom are unaware of these risk factors that we have listed today. Now, the risk of heart failure in the young is that when heart failure strikes young people, it can disrupt their lives in profound and deep ways. These individuals are often in the prime of their careers, raising families, or pursuing education. The financial burden of managing a chronic condition like heart failure can also be very overwhelming, especially in Nigeria, where healthcare costs are often out of pocket. Now, what are the solutions and preventive measures that we can look at for preventing heart failure in young people or making sure that young people are able to manage this condition? First, regular health checks. Many young Nigerians don't check their blood pressure or cholesterol levels until symptoms appear. Early detection is key. Visit a clinic for routine screenings, even if you feel healthy. Second, healthy eating. Reduce salt intake. Limit fried and processed foods. Include more fruits and vegetables and whole grains in your meals. A healthy diet supports heart health. Thirdly, make sure you exercise regularly. Aim for at least 30 minutes to an hour of physical activity most days of the week. Walking, jogging, or dancing can strengthen your heart. Fourth, avoid harmful substances. Say no to smoking. Say no to excessive alcohol and recreational drugs. These substances weaken your heart over time. Number five, treat infections properly. If you have a sore throat or other infections, seek medical attention early to prevent complications like rheumatic fever. Number six, make sure to manage your stress. Life in Nigeria can be stressful, so find ways to relax. And number seven, awareness and education. Communities need more awareness about the risk of heart failure in young people. Schools, religious groups, social organizations can play a role in spreading this knowledge. And also, this podcast, listening to this podcast and taking the great knowledge that you can get from here can also help you in the long run. A brighter future for our youth. Heart failure in young Nigerians is a growing concern, but it doesn't have to define our future. By understanding the causes, addressing the risk, and committing to preventive measures, we can protect the heart and the potential of our youth. Your heart is your engine. No matter your age, take care of it today and it will take care of you tomorrow. Remember, prevention isn't just better than cure, it's your lifeline to a healthy and fulfilling life. Thank you for listening to us at Secondary Podcast today. I'm your host, Dr. Tiwa, and I'll see you some other time.